Hi everyone, this is Dr. Merhaut with Elite Sports and Spine Chiropractic. Welcome to this week's Elite Education Series. We're going to be talking about arthritis. So we see arthritis every single day in the office. There are multiple different kinds of arthritis, but one we're specifically going to focus on is osteoarthritis, degenerative joint disease. So basically what that is the joints over time will degenerate and oftentimes cause pain in different areas. So with arthritis, we see a lot of it within the knees, we see it in the hips, we see it all throughout the spine, low back, mid back, as well as up into the neck. We see it in the wrists, elbows, shoulders. Arthritis can really, degenerative arthritis, DJD, which is degenerative joint disease, can really be within any joint. So oftentimes I get, well, why do I always have pain on my right side? So if someone comes in, they say, why do I always have pain on my right knee? It's always been that way. I never really injured it, didn't never remember anything that specifically would have caused it. And with that, just like a lot of other conditions in our office, we kind of define the root cause of the problem. So if it's arthritis within the knee, then it has to be something repetitive over time that's causing that stress, extra stress or abnormal stress within that area that causes it to degenerate over time quicker than it would on the other side. So one common thing that we look for is there a shortness in one leg compared to the other? So if you have a shortness in that leg, then your weight's always going to be shifted over to that side. And it's going to be a small micro trauma over and over and over again that causes degeneration over time, and that then later presents as arthritis in the knee. So with an x-ray, if we were to get an x-ray, we would see the joint space narrowing within the knee. So if I take the knee right here, it's more common in the knee to have DJD within the medial side of the knee, so the inside of the knee. So people complain of pain being on that inside of the knee when they're walking, when they're getting up, that kind of stuff. Sometimes they have that grinding, crunching sensation within their knee, and they always have it. So the inside of the knee is typically what we see for arthritis, degenerative joint disease in this area. That main reason for that is in females. Oftentimes we have that valgus stress, meaning there's more pressure and stress being put through the inside of the knee because the hips are a little bit wider. So if females are going through knee surgeries or have knee problems, oftentimes the degenerative changes take place on the inside. It's because of just anatomically their hips are a little bit wider for childbirth. If you've played sports, if you have a job that's labor intensive where you're constantly on your feet or walking on uneven surfaces, those are other reasons that degenerative changes take place. So the body responds in a way where if there's stress being put on a bone, the bone's going to react to it. So sometimes you heard people have different spurs. So you can have heel spurs, you can have bone spurs within the neck, within the low back. Bone spurs occur based on the stress that's being put on the body. So with a heel spur, oftentimes it's the plantar fascia or the Achilles tendon that's pulling on the bone in that area, and the response of that bone is to create a heel spur where it kind of protrudes outward. That can be the cause of pain, but oftentimes it's other things, whether it's inflammation or muscle tissue tension that's causing the pain in those areas. So things can be done for those heel spurs in the neck, the back, the heel, and the ankles, where you can get them cut out. Is that changing or fixing the problem? No, it's just kind of removing the response to the initial problem, which was the abnormal stress being put on that area, which then created that type of spurring within the bone. And then you're removing that specific problem, but the initial problem of the abnormal stress being put through that area is not being removed, and that's what you need to figure out. Is it a short leg? Is it a previously sprained ankle that caused one of the arches to drop? So the arch drops, the leg rotates inward, the hips shift a little bit, and so then there's different stress being put all the way up the body, all the way up the line through the spine. So you're figuring that out. What's the initial cause of the problem that's causing abnormal stress to be put on that specific area? And then, can we correct that? Is it a structural problem that you can potentially correct, or is it a functional problem that's a little bit easier to correct? we see those same things up in the neck. So the cascading effect into the neck, if there's any type of whiplash injury, if you're constantly looking down at a computer, if you're constantly looking down and texting, the body responds to that. So if you're constantly doing those things over and over and over again, it's going to change the position both structurally and functionally of the neck. So if the neck should have a nice curve, kind of like a backwards C curve, if you're constantly looking down, it flattens that curve out. And if it flattens that curve out over time, the spine loses its natural spring. So the spine is an S-shaped curve. It's shaped like that to provide the axial load down through the spine. So when you're walking, when you're jumping, when you're sitting, the force is going straight down. So the spine has a nice curve to it, so it can distribute forces in all directions and not go straight through the spine. So if that curve straightens out, if you're constantly looking forward, sometimes people have heard of a flattened cervical curve or a reverse cervical curve. When that happens, when it's flat, all the force is going straight through. When it's going straight through like that, the force is going through the vertebral bodies, so right through here. It's going through the vertebral discs, straight through there. And then the disc has no place to go. If the force is going straight down, the only place it really has to go is the least resistance, which is going to be back. So back or to the side. And when it goes back into the side, that's when we get disc bulge and disc herniations. So that's kind of the mechanism that occurs over time. People will say they have, disc bulge, they have herniations, things like that, but they never really did anything that would have caused that, like some type of accident or real specific trauma. So they're like, well, how did that happen over time? Well, it's because of postural changes and the stress being put through that area abnormally. So then it changes the force on the disc, and then the disc needs somewhere to go, and it gets forced backwards. So you can have degenerative joint disease, degenerative disc disease, that all lead to that kind of compression on the spine and the disc getting forced back. So arthritis in general can cascade into different disc problems as well. So over time, everybody is going to develop some type of arthritis. I have arthritis right now. You develop it even into your younger teenage years. There's research that shows that. It's just a matter of where it develops, how quickly it develops, and how are you taking care of it over time. So that's one of the reasons why it's so important to get checked, on a regular basis, because if there's abnormal stress being put through your body, it's just going to cascade over and over and over again, and then later on develop as some type of problem and be like, well, I never had knee pain before, but why did I wake up with knee pain today? It's because that was the last straw that broke the camel's back, and there were already problems previously, but now it's just presenting as pain. So that's kind of the whole story and spiel on how arthritis develops and why it presents differently in different areas, or why people ask, oh, why do I have pain here and I never had an injury there before? So if you know anybody with arthritis, specifically osteoarthritis or degenerative joint disease, please share this with them. If you feel like anybody can be helped through this video, share them, tag them in it, like it, comment. I'd be happy to answer any questions. If you have any suggestions on any other type of arthritis that you want me to cover, please also comment on that, and I'd be happy to cover that. But this is the Elite Education Series. I'm Dr. Merhaut, and I hope you join us next week.